Welcome to the Cardinal Minute with your host and chair of the University of Louisville Department of Medicine, Dr. Kim Williams.
Thank you very much, Dr. Kharfan-Dabaja, for providing us with our University of Louisville Grand Rounds today with the focus on your view of the progress of CAR T-cell therapy in diffuse large B-cell lymphoma. In a short summary, how would you give the take-home message from today's talk?
Thank you, Dr. Hegazi, for the honor of inviting me to participate in this important grand round. I would say that the main take-home message is that CAR T-cell therapies have certainly revolutionized the treatment of diffuse large B-cell lymphoma, and they are here to stay. Nowadays, we know that at least 2 of the products are approved for patients who have failed to respond to frontline anthracycline-based chemoimmunotherapy or relapse within less than 12 months. And we also know that at least there are 3 products that are also approved for patients who fail 2 or more lines of therapy. So what is impressive with the CAR T-cell therapy, in my opinion, is that in the past, the probability of achieving a complete remission for patients who have failed 2 or more lines of therapy was somewhere between 2 to 10%. Nowadays, we can see response complete remission rates exceeding 50% or so. So that's certainly one of the important aspects of this therapy. But more importantly is the improvement in survival. We can see nowadays that 5 years later, over 40% of the patients are alive after receiving these CAR T-cell therapies, and that was not possible before this treatment became available. I would say that in my best estimates, probably for somebody who was truly chemo refractory, the 1 to 2 year survival was certainly less than 15% or so. So certainly these have improved the outcomes of patients, and in terms of whether we can call them cure or not, cure is a definition based on time, but certainly having more than 40% of patients alive 5 years later is certainly an encouraging sign that we are moving in the right direction, and these products are here to stay and will continue to contribute to saving the life of many patients with large B-cell lymphoma.
Thank you very much for the short summary, as well as the nice presentation, enlightening us, as well as the whole Department of Medicine on this topic. Appreciate your time.
It was a true honor. Thank you so much for inviting me on.
Thank you.